What's up, everybody? It's Paul, TRT bro. It is Friday, the 27th of February. First of all, I'd like to apologize for my hair. It is a wreck. Fortunately, I live in North Texas, so we've been having what equates to us as a blizzard. Snow started coming down about 9 o'clock this morning, and it's accumulating all over the roads. We have hundreds of accidents. So it's a mess out there. So anybody in North Texas, be safe. Stay off the roads if you can. Unfortunately, my gym decided to close right when I got there. After I was finished with work today, I called up to make sure that they were still open. They said they were. Ran home, got changed up, took my pre-workout, went up there, and they were closed. So, unfortunately, I won't be able to get my deadlift session in today, and I'm all hopped up on pre-workout right now, so forgive me if I talk a little fast. Today, I'm going to be talking about my treatment protocol for testosterone therapy. I went in today for my second injection. I got actually an email asking me about what my treatment protocol is, so I wanted to make sure that I got all the levels correct in my mind before I came and talked about it, because to be honest with you, after the first injection I didn't get a printout or anything, so I didn't know exactly for sure what the dosage was. So what I'm on starting out is 120 milliliters of testosterone cypionate per week, along with 500 IUs of HCG. Now, of course, the testosterone cypionate is the steroid used to reintroduce the proper levels of testosterone in my blood system, and then the HCG is used mostly to preserve testicle function. If you know anything about anabolics or steroids in general, you've probably heard that testicles will shrink up. That's because once the testosterone is artificially introduced into your system, it triggers the brain to stop sending signals to your testicles to produce its own testosterone, so they will atrophy as they cease to function. So the HCG helps to maintain testicular function. So in case you're worried about fertility or just the size of your testicles, which for me, to be honest with you, I'm so tired of accidentally sitting on one or or getting one pinched as I'm rearranging myself on the couch. That wasn't really a concern, but I think most doctors treating low T now, at least in younger men, prefer to go ahead and use the HCG, because I think the results for most men have shown that it helps maintain libido, it helps maintain a better sense of well-being, and overall it just seems to be a healthier choice for most men. Actually, it was interesting. My doctor asked me today if I'd had anything weird after the first injection. One thing that I did notice, and really the only effect that I noticed, to be honest with you, other than the surge of energy on the day that it peaked, was that my left testicle actually started having this really dull, but it was pretty strong aching for about a day and a half, and that was on like Monday and Tuesday. So as the testosterone level in my body was peaking, for some reason my testicles started aching, and obviously that's looking into it, that's a pretty normal thing. The doctor said it was a normal thing. Usually only lasts for the first couple of injections, so 2 to 3 weeks. After that sensation shouldn't be a problem anymore. So moving forward, that's when I'm going to continue the same dosages for at least a month, and then they'll go back and take more blood levels, just to make sure that I'm within range where they want me to be. Make sure it's not too low, so where I'm not reaping as much benefit as I should, in which case they might up the dosage, or if it's too high, they might bring it down a little bit. I did get the results of the full blood panel that they took from the last blood test. My testosterone had gone down again. total testosterone was 370. Free testosterone was slightly above 9. It was 9.1. So still at the extreme bottom of the reference range where it should be for normal function. All the other levels looked fine. The estradiol, God, I hate that word, estradiol level was low, but not extremely low. So I think that first blood test that I took that really got me concerned was probably just an outlier. Follicle stimulating hormone was at the low end of the reference range. Luteinizing hormone was at the low end of the reference range. SHBG, that's the sex hormone binding globulin, was towards the bottom of the reference range, so that's not really a problem. A lot of men will find if their SHBG is too high, that's going to limit the amount of free testosterone that's in their system to be used for other functions like muscle building and the rest of your body's systems that need testosterone to function correctly. So in my case, that's not a problem. Testosterone, blah blah blah, and then the total prostate serum was at the low end of the reference range, so no danger of prostate cancer at this time. So everything looks pretty normal. All of my hormone levels appear to just be really low. So for me, I don't think it was anything outlying other than my body just isn't producing the correct amount of hormones for me to have normal function in day-to-day life. Another question that I'd gotten actually from a friend that I'd talked to about going on treatment, he made the comment that most people will make for someone like me. Like, sounds like somebody just wants to build muscle and burn fat better. To be honest with you, muscle building was not the problem for me. Like I said, I'm just a shade under 5'7". Today I weighed in at 149 pounds. Because I'm on a bulk right now too. But building muscle and burning fat, except for right around my waist, hasn't really been a problem. So I know you've all been wanting to know. Actually, probably nobody has. But I'm going to show off anyway because I'm pretty proud of my physique right now. So I didn't work out today, so no pump or anything. But as you can see, I've got a decent amount of muscle on me. Nothing extraordinary, nothing special, but I haven't had any problem building muscle. That's not what this is about. Like I said, it's really about me not feeling great most of the time, except when I've been in the gym, hopped up on pre-workouts. So anyways, that's the status. Got the second injection today. We'll see how it goes this next week. I'll do another update on peaking day, which for me, that'll be, I guess that'll probably be Monday. I'll let you know how I'm feeling, if I notice any noticeable changes. Probably not, though. Most people say the changes really don't come until you've been on it for 3 to 6 weeks, somewhere in that area. So tomorrow, I'm hoping that I can get my deadlift session in, and Sunday, hoping to get my overhead press session in, because I wanted to do an update on my Wendler progress. It'll be 3 weeks into the program. I'll let you know where I'm doing there. So hopefully I'll be able to get that up Sunday, might be Monday, depending on, like I said, if I can get in the last 2 workouts for this week. So I'm glad that people seem to be enjoying the videos, people that I've talked to, the people that have seen it. Gotten a few emails, like I said. So just let me know how I can make the channel better, if there's anything else that you want to see. Otherwise, comment below, ask me any questions you might have, and recommend it to your friends or anybody else that you think might be interested in it. I appreciate your time, and we'll see you again next time. Thanks.